Antihypertensive medications are prescribed to manage high blood pressure, hypertension, and reduce the risk of cardiovascular events. These medications are categorized based on their mechanisms of action. Next is an overview of common classes, their side effects, contraindications, and explanations for these contraindications. 1. Diuretics. Types: thiazide diuretics, for example, hydrochlorothiazide; loop diuretics, for example, furosemide; potassium-sparing diuretics, for example, spironolactone. Side effects: electrolyte imbalances, for example, hypokalemia, hyperkalemia, dehydration, hypotension, increased urination. Contraindications: hypersensitivity, allergy to sulfonamide-derived diuretics, for example, thiazides; anuria, inability to produce urine; renal impairment, reduced kidney function may be exacerbated; electrolyte disturbances, existing imbalances may worsen; pregnancy. Some diuretics are not recommended due to potential harm to the fetus. 2. Beta blockers. Examples: metoprolol, atenolol beta-1 selective; propranolol, nadolol non-selective. Side effects: bradycardia, fatigue, dizziness, depression, bronchospasm, especially with non-selective beta blockers. Contraindications: asthma or COPD. Non-selective beta blockers can cause bronchoconstriction, second, third degree heart block, can worsen conduction issues, bradycardia, may further decrease heart rate, severe peripheral arterial disease, can reduce peripheral circulation. Metabolic syndrome, may adversely affect lipid and glucose metabolism. 3. ACE inhibitors, angiotensin converting enzyme inhibitors. Examples: lisinopril, enalapril, ramipril. Side effects: cough, hyperkalemia, angioedema, dizziness, hypotension. Contraindications: pregnancy, can cause fetal and neonatal injury or death; angioedema, history indicates increased risk; renal artery stenosis, can worsen renal function; hyperkalemia, risk is elevated when combined with potassium-sparing agents. 4. Angiotensin II receptor blockers, ARBs. Examples: losartan, valsartan, candesartan. Side effects: dizziness, hyperkalemia, renal impairment, angioedema, less common than with ACE inhibitors. Contraindications: pregnancy, similar risks as ACE inhibitors; renal artery stenosis, potential for renal function decline; hyperkalemia, especially when used with other potassium elevating agents. 5. Calcium channel blockers. Types: dihydroperidinase, amlodipine, nifedipine, non-dihydroperidinase, diltiazem, verapamil. Side effects: dihydroperidinase, peripheral edema, flushing, headache; non-dihydroperidinase, bradycardia, constipation, heart block. Contraindications: severe hypotension, can exacerbate low blood pressure, heart block, especially with non-dihydroperidinase; severe heart failure, may worsen symptoms. 6. Alpha-1 blockers. Examples: prazosin, terazosin, doxazosin. Side effects: orthostatic hypotension, dizziness, reflex tachycardia. Contraindications: orthostatic hypotension, risk of significant blood pressure drop upon standing; concurrent use with PDE5 inhibitors, increased risk of hypotension. 7. Central alpha-2 agonists. Examples: clonidine, methyldopa. Side effects: sedation, dry mouth, rebound hypertension upon abrupt discontinuation. Contraindications: hypotension, can further lower blood pressure; concurrent use with tricyclic antidepressants, risk of severe hypotension. 8. Direct renin inhibitors. Example: aliskiren. Side effects: diarrhea, hyperkalemia, renal impairment. Contraindications: pregnancy, potential harm to the fetus; concomitant use with ACE inhibitors or ARBs. Next session, we start to talk about each drug class. Don't forget to subscribe, like, share, and comment below.